Sickle cell disease is a very difficult disease to live with. It's actually an inherited blood disorder that can cause symptoms like anemia, pain, and fatigue.
That's why UConn Health's New England Sickle Cell Institute uses a team approach to treating patients, helping with both their medical and emotional needs.
Melissa Cole got a first-hand look at the groundbreaking treatments that they're using, including a new medicine.
So I was born with it. I believe I was diagnosed at 18 months. I started being hospitalized around the age of 2 and in and out of hospital from then on.
Marcus Brown of Vernon is talking about sickle cell disease. He's a patient here at the New England Sickle Cell Institute at UConn Health. Dr. Janice Nelson is one of his doctors.
So sickle cell disease is an inherited red blood cell disorder. So it's a genetic disease that's passed on from parents to their children. It's one of the first inherited diseases that was known about 20 years ago.
Does it mostly affect the African American population, or is that a misconception?
That is a misconception. It is dependent on where you were born. So if you are from a Caribbean island or someplace where malaria is prevalent, then you are at risk for sickle cell disease.
Anemia and pain are two of the most common symptoms.
Pain, which is the hallmark symptom of sickle cell disease, which is caused by the sickle cells becoming hard and sticky and clumping together and blocking blood vessels, and so that's what causes pain.
If you could describe what the pain feels like, are you able to do that?
Oh, wow. It's quite excruciating. It could be anywhere from mild pain to, pain that you feel like you're gonna, pass out and die.
So in sickle cell disease, the pain can occur at any given time. So someone can be asleep and wake up and be in pain, or they can be having a family event and suddenly become overtired or dehydrated and then have a pain event. So it is brought on by multiple stressors.
These pain events often lead to hospitalization requiring IV fluids and medication. It can take anywhere from hours to days to weeks to get the pain under control. The constant worry about when the pain will flare can cause a lot of anxiety and stress. And that's where social worker Teresa Works comes in.
Stress can be a big factor in exacerbation of the disease, of any disease, but in particular sickle cell disease. So meeting with people around their behavioral health needs, their grief, their anxiety, their depression, their post-traumatic stress, whatever it is, and trying to help them develop coping skills and some resiliency can really help to mitigate the actual disease flare-ups.
While there is no cure, here at this institute at UConn Health, there are some groundbreaking treatments, including a new medicine.
Essentially, crizamizumab or Adakveo is like having an oil change to your car. What it does is it prevents the cells from sticking together. So the cells will still sickle and they will still become hardened, but the crizamizumab allows the cells to move freely through the body so that they don't block the blood vessels and cause pain. So it does reduce the frequency and the intensity of their pain. It was approved by the FDA 2 years ago, and so once it was available, we started administering it. We were actually the first center in the state of Connecticut to be able to have this treatment.
Marcus takes this medicine and also receives a specialized blood transfusion.
I come here to the Sickle Cell Center a couple times a month. One is for infusion for sickle cell prevention medication, and the other is a prevention treatment called apheresis. I call it the human oil change because they, take my blood out and give me donor blood. So, staying on top of it is quite the task.
But the time Marcus puts in is worth it. His results, as well as many other patients here, are positive with an overall improved quality of life.
Able to do things with my children, go places with my wife. I'm able to hang out with friends, which, people take for granted, but with me it was difficult before then because, I would be sick and, would be asked, hey, let's go out somewhere. And I'm like, I can't, I don't feel well,
And for the first time in a long time, Marcus and his wife went on vacation without the worry of a pain flare-up. Dr. Nelson says there are other new medicines and trials coming soon.
I think that our program is one of the leading programs in the United States for the management of adults with sickle cell disease. We are actively engaged in trying to improve the quality of life and the quality of care that individuals who have sickle cell disease live with in the state of Connecticut.
One thing I want people to know about sickle cell is, yes, it affects predominantly African Americans, but it affects people all walks of life. It doesn't matter if you're Asian, Italian, Irish, Greek, it affects all of us. So I would like people to know that, you know, it's a universal illness. It's not just a African American thing. You know, it's something we all go through.
All right, the New England Sickle Cell Institute at UConn Health is dedicated to providing quality patient care to adults living with sickle cell disease.
For more information, you can visit health.uconn.edu. You can also request an appointment by calling the number you see on your screen. It is 860-679-2100. Learned a lot there.